Today we're diving into an essential read for anyone involved in trauma care.
Oh, what's the book? I'm curious already.
It's called Trauma Pitfalls by Dr. Atef Ahmed. It's a guide that highlights the most common errors in trauma management and how to avoid
Right.
them.
That sounds incredibly useful. But aren't there already plenty of books on trauma care?
Well, yes, but this one is unique because it's rooted in the ATLS framework. You know, the Advanced Trauma Life Support Principles, and offers practical solutions to real-world challenges.
So it's evidence-based then?
Exactly. Dr. Ahmed brings his extensive experience as a trauma surgeon and educator to
Yeah.
provide actionable strategies.
But can't these pitfalls be learned through experience? I mean, is a book really necessary?
That's a fair point, but the book accelerates the learning curve. It helps practitioners avoid common mistakes before they happen. It's like having a seasoned mentor guiding you, which
I
can be
see.
crucial in trauma care.
Makes sense. Can you give an example of the pitfalls he discusses?
Sure. In the chapter on airway and ventilation management, he talks about common mistakes during intubation
Right.
and how to anticipate airway difficulties.
That's crucial. Airway management can make or break a patient's outcome.
Absolutely. And he doesn't just point out errors, he provides practical guidance to avoid them. It's
Exactly.
very hands-on.
So it's not just theoretical, it offers real solutions.
Exactly. It's like having a mentor guiding you through each step,
Yeah.
ensuring you don't miss anything important.
Who's the target audience? Is it suitable for trainees or more seasoned professionals?
Both, actually. It's great for trauma surgeons, emergency physicians, residents, advanced practice providers, even medical students interested in trauma care.
That's quite encompassing. Does it address different settings, like rural or resource-limited hospitals?
Yes, there's a chapter on trauma in rural or resource-limited settings.
Oh,
It
perfect.
discusses how to adapt trauma care principles when resources are scarce.
That's really important. Not everyone works in a Level Y trauma center?
Exactly. It recognizes the universal applicability of its lessons,
Right.
making it useful no matter where you practice.
Does it cover specific populations too, like pediatric or geriatric trauma?
It does. There are dedicated chapters on pediatric trauma, geriatric trauma, and even pregnancy and trauma.
Interesting.
It covers the nuances involved in treating these groups.
That's comprehensive. But does it go into team dynamics? You know, human factors in trauma care?
Yes, the final chapters address team dynamics and human factors, emphasizing the importance of communication and coordination.
So it's not just about clinical skills, but also soft skills.
Exactly. Trauma care is a team effort after all,
Yeah.
and effective teamwork can save lives.
You mentioned earlier that it's rooted in the ATLS framework. Does it bring anything new to the table?
Well, it builds upon ATLS principles but delves deeper into the pitfalls practitioners often overlook.
Right.
So it's like an advanced guide, you know?
Got it. Are there any endorsements or reviews that stand out?
Yes. One reviewer called it an indispensable guide for trauma care professionals seeking to elevate their practice.
Nice.
Another said it's essential reading for those striving for excellence.
High praise indeed. But do you think it's accessible for someone early in their career?
I believe so. While it's comprehensive, Dr. Ahmed's writing is very approachable. He makes complex topics understandable.
That's good. That's reassuring. Sometimes medical text can be pretty dense.
Yeah, but this one is different. It's
Great.
engaging and easy to read.
Where can people get this book?
It's available through leading retailers and online platforms. Amazon, Lulu, Apple Books, Barnes & Noble, both in paperback
everywhere.
and ebook formats. Absolutely, I think it's a
Yeah.
must-have.
Before we wrap up, any final thoughts?
Just that Trauma Pitfalls is more than a book. It's a call to action to improve patient care by avoiding critical errors.
Indeed.
It's about elevating the standard of trauma care.
That's inspiring. I think anyone involved in trauma care should check it out.
Agreed. And, don't forget to like, subscribe, and share this podcast.
For
and
sure.
share the book links too.
Let's get the word out. Thanks for joining us, everyone.
Thank you. Until next time.